Hi, I'm Dr. Helane Fronek, and I'm here today with Dr. Nick Morrison. Nick, you're a general surgeon, which means that you probably, in your training, did a lot of vein strippings.
Yeah, we did a lot of vein stripping. Actually, up until about 15 years ago, we were still doing vein strippings. And I will tell you that anybody who ever did one or saw one never wanted to have one.
Right. I've seen a lot of patients who come in saying, if I knew then what I know now,
Right.
I would never have that done.
Yeah.
So you and I, having been in the field for a long time, have seen a lot of different treatments come along, haven't we?
Yeah, it's been a pretty dramatic and fairly rapid change in the last really 10 to 12 years.
Yeah. So what are some of your favorite new treatments for varicose veins?
Probably the main one is the endovenous thermal ablation, where we use heat, either in the form of laser energy or radio frequency, to close a vein down. It works very, very well. It's very effective, and that's probably one of the best things that we do.
So what is that like for a patient to go through?
It's not painless, but it is minimally painful. And by that I mean it's not unlike having a local anesthetic for a dental examination or for a dental procedure, for example. So it's not something that's awful to go through, but it's something.
It's something.
Yeah.
Yeah, I find that...
excuse me, I always tell people, don't think we're doing nothing, because we are.
Right,
Yeah.
right. I'm with you on that. I think it's very important to let people know what they're going to go through, that it isn't nothing, that they go through something and then they get a really good outcome at the end.
Yeah, and it's important to let them know that afterwards they're going to realize that we did something. It's not going to be just a bump in the road, so to speak. It's going to be some recovery that's required.
Okay. What I find to be really great about the procedures that we do nowadays, let's say the endovenous thermal ablation, is that people can come in, we do the procedure. It takes us about an hour, plus or minus a little bit of time.
Yes.
And then do your patients normally go back to work within a day, or how long does that really take?
Okay, typically it's within a day or so. Some people who work fairly vigorously, for example, the nurse who has a 12-hour shift in the emergency department, that's a person who's going to take maybe an extra day off. But most people, they're ready to get back to pretty much full activity by the following day.
And how successful are these treatments?
The thermal ablation procedures are quite successful, assuming that you follow the patient up and watch and make sure that things close down the way you want. Because that's what we're doing. We're taking abnormal veins and closing them down and letting the patient's own body reabsorb those veins. And that's as opposed to the old stripping procedure where we used to strip the vein out and then the patient had to heal from that. So it's considerably less than that.
Are endovenous thermal ablation procedures useful for every vein?
No. This is a technical procedure, and the catheters that we use are relatively stiff, so you need to have a straight vein that can be treated. So the veins, for example, on the surface of the leg that are problematic for the patient, we won't treat those generally with thermal ablation. We'll do some other maneuver.
So how do you decide what procedure you're going to do on a given patient?
It depends a lot on what the patient feels, what they have as a way of physical findings, and then the ultrasound examination that we have done will help tell us where we need to treat and how extensive that treatment has to be.
Tell me about the other treatment that you do.
You do a lot of phlebectomy, for example. Phlebectomy means making a micro-incision and removing large bulging veins. We do lots of ultrasound-guided sclerotherapy. So this is treatment for veins that are beneath the skin that we can't see, and we need a method to see them, and we use ultrasound. So we image the vein so that we can see it on a screen, and then watching that screen, put a little needle into the vein and inject some solution to make it close down.
So it sounds like ultrasound-guided sclerotherapy is something that you can do for almost any vein.
You can, although it's probably not recommended necessarily for those veins that are very prominent on the surface. The recovery is going to be quite a bit longer if you do sclerotherapy on those. So those are veins that you probably would do better by removing.
Okay. You know, I think that we're in a really good phase of vein treatment right now. I know in years gone by, we had one procedure, whether it was stripping or for a while it was sclerotherapy, and we would try to treat every patient with that. And I often tell my patients that now we look at them and we look at the ultrasound and we say, oh, you have this vein. This vein responds best to this treatment. Or you have that vein. That vein responds best to that treatment.
Yeah, our armamentarium has grown quite a lot in the last 10 years, and it makes it, and things are coming along all of the time. So we see almost on a weekly basis, it seems like we get a new treatment that is introduced, and some of them work well and some of them don't, and that's what the trials are for, to figure that out.
Yeah, there's really a tremendous amount of research being done in this field, isn't there?
There is, and it's really exciting because the field is not well understood. Venous disease, historically, is not well understood. And the research that's going on now is designed to help understand that disease process. And that's what makes it a lot of fun.
It is a lot of fun, and as you just mentioned, it's exciting.
Yes.
Whenever we have more knowledge and better technologies to help our patients, that makes life pretty exciting for us, doesn't it?
It does. When I think of the patients who I used to see in the hospital for 2 or 3 days after a stripping procedure at bed rest, and then are wheeled out in a wheelchair and are going to be incapacitated for a few weeks afterwards, it is really exciting for me to watch a patient after an extensive procedure simply walk out of the office and go on about their daily life.
I know that the old vein strippings were associated with a lot of pretty significant complications. How about these new treatments, the endovenous thermal ablation or the ultrasound-guided sclerotherapy? Are there a lot of complications with those as well?
There are generally fewer complications than with the stripping procedure for any of the newer methods. They are not complication-free. Nothing is, but the complications generally are less severe and less frequently seen.
And what about if a patient comes back, let's say a few years after we treat them, and they have new varicose veins? Can these procedures be repeated?
They can. It depends on which procedures. We always tell patients, you will not be free of veins for the rest of your life. I tease patients sometimes and tell them, I hope you get veins come back again because that means you live long enough to have it happen. So I tell them recurrence is very, very high. You probably are going to get other veins, but they can be treated just the same.
One analogy that someone told me that I think really explains vein treatment very well is it's good to look at vein disease much like we look at dental care. So we go in and we get our teeth cleaned a couple times a year, and then maybe we need a root canal, or maybe we need a filling. What do you think about that?
Yeah, I think that's a great analogy, and we use that all the time in our own practice.
You do, okay.
We do. It really helps patients understand that this is not a one-time cures-all sort of process. I always tell patients, I'm not going to cure you of this problem, but I am going to control it pretty successfully.
So that's really our goal, is to make sure that our patients are able to do the things that they want, that their vein problems don't get in the way of that.
Right, yeah. Quality of life is really important, and especially in a place like Arizona, where I live, the patients are outside, they're active a lot, and that quality of life is very important to those patients, and being able to return to that quality of life is terrific.
Yeah, that's really the bottom line. We can do a lot of procedures, and to us as physicians, we may say, well, now the vein is closed up, we're very happy, we did a good job. But it's really watching our patients be able to have the life that they want as a result of treating their vein disorder. That makes me happy.
Yeah, it is. There are many of the technical procedures that we can do and achieve technical success, but if you haven't returned the patient, haven't satisfied the patient's desires and needs, you probably haven't done a very good job for that patient.
Yeah. Well, nowadays, and I'm sure you would agree, we're really able to satisfy the patient's needs a lot better than before with the new treatments that we have available.
No question. Much better. Much better.
So it's a great time to be a vein doctor, and it's a great time to be a vein patient.
Yeah, I agree. I agree.
Nick, I want to really thank you for coming in today and sharing some of these new advances in the field of vein disease and talk a little bit about the great treatments that we have.
Oh, you're welcome. I enjoyed it. Thank you.
Thank you.